Cytogam Vial is used to prevent a serious viral infection called cytomegalovirus, CMV, in people who have had an organ transplant, such as kidney, heart, liver, lung, or pancreas. When a person receives an organ transplant, their immune system is weakened to prevent rejection of the new organ. This weakened immune system can increase the risk of a serious, possibly fatal infection with CMV. Cytogam Vial is made from healthy human blood that contains high levels of certain defensive substances, antibodies, that help fight CMV. It is often used in combination with the antiviral medication ganciclovir. The recommended dosage and timing for taking Cytogam Vial will be determined by your healthcare provider based on your specific medical condition. Be sure to follow their instructions carefully. This medication is given through a slow infusion into a vein as directed by your doctor, usually every 2 to 4 weeks, with the first dose given within 3 days of the transplant. The dosage and frequency depends on your medical condition, weight, and response to treatment. Your healthcare professional will start the medication slowly while monitoring you closely. If you have few or no side effects, the medication will be given faster. Tell your healthcare professional right away if you experience any side effects such as flushing, chills, muscle cramps, back/joint pain, fever, nausea, vomiting, or shortness of breath. The infusion may need to be stopped or given more slowly. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. Keep all your medical/lab appointments. Some common side effects of Cytogam Vial may include flushing, chills, muscle cramps, back/joint pain, fever, and nausea/vomiting. You may also experience pain, redness, and swelling at the injection site. If any of these effects persist or worsen, it is important to notify your doctor. It's essential to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects. While many people using this medication do not experience serious side effects, it is important to notify your doctor immediately if you experience easy bleeding/bruising, fast/irregular heartbeat, unusual tiredness, signs of kidney problems, or sudden weight gain. In rare cases, treatment with Cytogam Vial may cause inflammation of the brain or lung problems. Seek medical help right away if you experience severe symptoms such as severe headache, stiff neck, drowsiness, high fever, sensitivity to light, eye pain, severe nausea/vomiting, or lung problems occurring 1 to 6 hours after treatment. Additionally, while very rare, a serious allergic reaction may occur. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Serious blood clots may rarely occur as a side effect of using Cytogam Vial. You may have a higher risk of developing blood clots if you are an older adult, severely dehydrated, have a catheter in a vein close to your heart, or have a history of certain health conditions. If you use estrogen-containing products, this may also increase your risk. Talk to your doctor about the risks and benefits of using Cytogam Vial, and make sure to report any of these conditions to your doctor or pharmacist. To lower the risk of blood clots, the medication can be infused more slowly or a less concentrated form can be used if available. Staying hydrated before receiving the medication may also help reduce this risk. Seek medical help immediately if you experience shortness of breath, chest or arm pain, unusual sweating, dizziness, fainting, pain or swelling in the arm or leg, severe headache, trouble speaking, weakness on one side of the body, sudden vision changes, or confusion. Before using Cytogam Vial, it's important to discuss any allergies you may have with your doctor or pharmacist. They can help determine if this medication is safe for you. It's also important to provide your medical history, especially if you have certain immune system problems, diabetes, high blood pressure, high blood fats, migraines, kidney disease, or severe dehydration. If you have recently had or plan to have any immunizations or vaccinations, it's important to inform your doctor. Cytogam Vial may affect your body's response to certain live viral vaccines, and your doctor can advise you on the best timing for these vaccinations. Since this medication is made from human blood, there is a very small chance of infection. Your doctor or pharmacist can provide more information on the precautions taken to minimize this risk. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, Cytogam Vial should only be used if clearly needed. It is also important to consult your doctor before breastfeeding, as it is not known if this drug passes into breast milk. It's important to be aware of potential drug interactions when using Cytogam Vial. Interactions with other medications can affect how Cytogam works and may increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you are using, and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Some products that may interact with Cytogam Vial include drugs that can harm the kidneys, such as gentamicin, and water pills, like furosemide. Be sure to discuss any concerns about potential interactions with your healthcare provider. If someone has taken too much Cytogam and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center for assistance. In the U.S., residents can call 1-800-222-1222 to reach their local poison control center, while Canadian residents can reach out to their provincial poison control center for help. It is important to note that you may need to undergo lab and/or medical tests while using Cytogam Vial, such as kidney function and urine volume tests. It is important to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose of Cytogam Vial, it is important to contact your doctor or pharmacist immediately for a new dosing schedule. Do not take a double dose to make up for the missed one. This medication is typically administered by a healthcare professional, so it is important to follow their instructions carefully. Cytogam Vial is used to prevent certain infections in people who have received an organ transplant. It is also used to treat certain infections in kidney transplant patients. The dosage and timing of Cytogam Vial will depend on your medical condition and response to treatment. Be sure to follow your doctor's instructions and ask any questions you may have about the medication. Make sure to store Cytogam Vial in the refrigerator and use open vials within 6 hours. Any unused portion should be discarded and kept away from children and pets. It is important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.